One of the most common areas where most people are going to experience chronic pain comes from excessive tightness and tension of a muscle that sits on the tops of shoulders known as the upper trapezius. Now, not only is this one of the most nagging and consistently annoying pains that people deal with on almost a daily basis, but left alone, it could actually lead to worse problems such as causing, tension headaches. It could also be the root of what's causing a feeling of a pinched nerve in the neck as well. And it could potentially also lead to other shoulder issues such as shoulder impingement or also other rotator cuff problems as well. But the truth is, this is a problem that can actually be fixed. But I find that most people either take the wrong approach or wrong strategy, or they actually have no idea that they can actually do something to help solve some of these problems, and they just continue to live each day with just a bunch of pain or a bunch of tightness, or just consistently bothered by this problem, and again have no idea that there's actually something that can be done to actually help them fix this problem long term. So my goal for this video is to share with you what the underlying causes of this problem actually are and why actually most stretches or exercises or treatments that people do could actually be making the problem worse. And then from there, I'll share with you some of our favorite strategies, not only to help you find some immediate relief for this issue, but to also make sure that you find some long-term relief for this problem as well. All right, so with us today is my wife Tweet, and she's going to be helping us through some of the exercises and some of the demonstrations today. All right. Now, the first thing that what we're going to do in this video is to first share with you what I believe are the three most common underlying root causes of what is actually causing this, kind of constant or chronic pain or tightness of that muscle on the top of the shoulder known as the upper trapezius, right? And once we have helped you understand what these causes are, then we're going to share with you some of our favorite corrective strategies to help you solve some of these issues, to help you find some long-lasting and permanent relief for this kind of constant and chronic pain of this muscle as well. All right, so let's go into the first demonstration. Now, the first thing that I want to demonstrate to you, and I don't think this is going to come as a shock or a surprise to anybody, but just the fact is a lot of our patients who are coming in with this type of problem just seem to have no idea, how much this problem is actually causing this pain on the top of the shoulder. So I felt it was worthwhile to do a demonstration just to kind of highlight the point a little bit further, right? Now, the biggest underlying root cause of what is causing this kind of constant and chronic pain is just quite simply due to poor posture, right? Now, this, again, shouldn't come as a shock or a surprise, just given how much time people are kind of spending looking down at their phones or spending all day long working in front of a computer screen. But as you can see here, when somebody kind of enters this kind of hunched back or kind of rounded shoulder posture, not only does this look quite uncomfortable, but this actually causes a lot of stress and a lot of strain just to kind of build up within this muscle, just because of the positioning of the body itself, right? So as you can see here, with the upper back just kind of in this rounded position, with the shoulders kind of hunched forward and with the neck kind of like hinged backwards as well. These are the main contributing factors to what I believe is causing this muscle to enter this constant state of pain and tightness. All right. All right. So what we're going to do next is just to kind of zoom in a little bit, just to kind of show you exactly what is going on at the level of this muscle, just to give you a better idea of how much posture is actually contributing to the pain and tightness of this muscle. Just to zoom in a little bit here, so what we want to do is just to show you what actually happens to this upper trap muscle once it kind of starts from a proper posture like so into more of a kind of slumped or slouched posture, right? So the first thing that I want you to recognize is that when Twee here is in a good or kind of upright posture, is that when I actually kind of just press on this muscle of the upper trapezius, it is actually very soft and it's actually very relaxed. And now this is the actual secret, and this is what we actually want to do to help you find that kind of long-lasting permanent relief for this muscle, is to get this muscle to a point where it is relaxed all the time, right? So as you can see here, it's very soft, it's very kind of easy to touch, and it's not tight or tense at all, right? But once she kind of enters this kind of like slouch posture like so, the first thing they want you to realize is, first of all, how uncomfortable this looks. And secondly, when I actually kind of press on this muscle, it is very tight, it is very tense, it almost feels like a rubber band, right? And this is what I want you to realize, is that when the muscle is in this position for long periods of time, this is what's going to cause it to kind of enter this constant or chronic state where it's just kind of tight and just kind of forms all these kinks and all these knots. And it's just, again, a very uncomfortable position for our muscles to be in, right? So I'm going to use this kind of orange band just to kind of highlight the point a little bit further, right? So again, as she kind of sits upright, right, the first thing I want you to recognize is that, when she is in an upright position, if this orange band here is the muscle, then that means that the muscle is in a very relaxed position. This muscle is on slack, and there's no tightness and there's no tension to this muscle at all. All right, but then as she enters a slouch position, right, as you can start to see, if I just kind of trace that muscle, is it starts to get very tight, it starts to get very tense. All right, and as you can see here, when this muscle is tight and when it is tense, that's what's actually going to cause it to enter this kind of constant and chronic state. All right, now this is the main reason why, I believe that when most people try to tell you to kind of stretch this muscle to try to find, some relief for this muscle, the reason why I think that this actually makes the condition worse is the fact that we're just taking that rope, we're taking that band, and we're just making it tighter. All right, and while this might feel good temporarily when you do it, long term, I think that it just contributes to creating more tension and more stress on the muscle, which again, I think is what actually makes it worse. Right? So what we actually want to do to actually fix and solve this issue is to be able to correct the underlying postural problems to, again, get the muscle to a point where it is on slack, where it is relaxed, and is pretty much just kind of loose throughout the course of the day. All right, and what I want you to realize is that when it is in this kind of loose, relaxed state, this is it's going to get to a point where you will barely feel this muscle at all. It'll just, again, be to the point where you don't even notice that it's even there. All right. All right, so just to zoom back out, what we want to do next is to share with you some of our favorite ways to be able to help you get from a point where you might be more slumped or slouched forward, where you might be feeling a lot of constant or chronic tightness of this muscle, to a point where you are able to sit more upright throughout the course of the day, so that your shoulders are in a much more relaxed and a much more kind of looser position, so you're not feeling that constant or chronic tightness of that muscle. The first thing that we want to show you, in terms of how to get your posture in a better position to help you release some of that constant and chronic tightness of the upper trap, is to help you restore stiffness and tightness you may be experiencing within the middle part of your back, known as the thoracic spine. Right now, just as a demonstration for people who are kind of stuck in this kind of like rounded shoulder posture, like so, to go and demonstrate. Is the first thing that's going to happen is, again, when your upper back is kind of stuck in this position, it's going to get stuck in this forward bent position known as hyperkyphosis. All right. Now, this is something that most people are not aware of as to what is happening to them, because it happens so slowly over a long period of time. But if we actually do want to get to a point where we are able to help you fix and correct your posture, then we first must help you restore any lost mobility or range of motion within these vertebrae. All right. So we're going to be using a foam roller to help you first assess to see how tight or how stiff you actually are. And then this is actually one of my favorite ways to help you restore the range of motion of this area. All right, so Twee, let's go ahead and lie on the foam roller. All right, so what Twee's going to do is she's going to start by laying over this foam roller, just kind of crossways. And she's going to just kind of sit right between her shoulder blades like so. All right, and what the goal is for her to, as she starts to bend back over the roller, try to essentially touch her head all the way towards the floor. All right. Now, if you are able to touch your head all the way towards the floor, this is what we would call a passing test, which means that she has good range of motion and mobility within these vertebrae, right? Which is a good thing, and this is something that we want to be able to help you work towards. All right, so Twee, go ahead and come back up. Now, for people who might be really stiff or who have a lot of stiffness within this part of the body, as they actually try to bend backwards, go ahead and demonstrate, is that they might start to get stuck, or they might start to feel a lot of tightness or resistance, sometimes just even halfway through like so. Right now, as you try this, if you start to feel like this is happening to you, where you kind of start to feel a lot of tightness or you feel a lot of kind of discomfort within this area, then just try to stay right there and hold it there for a couple seconds. Right, and just take a couple of deep breaths in, and as you exhale, just try to slowly start to extend your back over the roller, right, and then eventually be able to try to work your head all the way towards the floor, all right, and just stay there for a couple of seconds. Don't try to rush through this, all right, and then once you feel like you're able to get into a stretch again, take a deep breath in, exhale, and just try to slowly relax into a deeper stretch, and try to get your head to be able to touch closer towards the floor. All right, you want to repeat this about 5 times, all right? And then let's demonstrate one more time. And exhale, and go a little further towards the floor like so. 3, 2, 1, reset. All right, so you want to do it about 5 times, as we said before. And then from there, you want to make sure that you also work on an area just below from where you started on. So to go ahead and move the roller down your back a little bit, like so, and park it right there. And then you want to repeat the same thing, right? So first, see if you can touch your head all the way towards the floor like so. And then if you start to get stuck or stiff about halfway through, then just take a couple of breaths just to make sure that you are learning how to relax into the stretch to start to slowly increase the range of motion of those joints of your upper back. All right, so about 5 times at that lower segment, all right? And then come back up. And then we recommend that you also perform just higher from where you started before, just kind of at the base of your neck like there, like so. And then repeat the same thing, all right? Just try to arch as far back as you can over the roller. And if you do start to get stuck, if you do start to feel a lot of tightness or resistance, just take a couple of deep breaths in. And as you exhale, just try to slowly be able to get your head to come a little bit closer towards the ground while focusing on trying to create a backward bending curve across your mid to upper back like so. 3, 2, 1. All right, and that's it. All right, so that's it for the first both assessment and stretching exercise to help you get rid of some of that constant or chronic tightness of the upper back, which is to help you increase and restore the range of motion of the joints of your mid to upper back. All right, so the next exercise we want to show you is an exercise known as the cow stretch. All right, so let's go and demonstrate. So the cow stretch is a very simple yoga exercise that is really specifically designed to help you not only increase the range of motion within this middle part of your back, but to also help you start to activate and strengthen a lot of the tiny little muscles along your back that are responsible for managing your posture. And this is also one of our favorite ways to help you start to untrain some of the tightness that you may be feeling of the muscles on the top of the shoulder, right? So what Tweet's going to do is she's going to start on her hands and her knees. Go and bring your knees up just a little bit, Tweet. And you want to make sure that your knees are kind of right underneath your hips and your hands are right underneath your shoulders, right? And what Tweet's going to do is she's going to try to create a backward bending curve right across the mid to upper back like so. And she's going to accomplish that just by trying to sink her chest and sink her ribs down. Again, try to feel the formation of a backward bending curve occurring right across the mid to upper back. And once you kind of get into the stretch, try to hold it there for about 10 seconds and just try to take a couple of nice deep breaths in. And as you exhale, try to just kind of sink your chest down into a deeper stretch like so. All right, and hold it there for 3, 2, 1, and go ahead and reset. All right, let's just demonstrate that a couple more times. All right, so again, just trying to start by sinking her chest and sinking her ribs and trying to focus on creating a backward bending curvature across the mid to upper back, while also simultaneously making sure that her shoulders are actually starting to stay down away from her ears as well, to make sure that her shoulders are not hiking up towards her ears, all right? So this is a common thing that we'll see for a lot of people the second they start to do this exercise, is when they start to kind of sink down, we'll start to see their shoulders start to migrate up towards the ears. All right, that's a tendency for those traps to want to kick in when we don't want them to. So again, make sure that you do concentrate on trying to push those shoulders down away from the ear so that these muscles stay soft and relaxed the entire time. And then take a deep breath in and sink down into a deeper stretch. And you know this, you'll know that you're doing this exercise correctly if you start to feel quite a good bit of stretching and just a lot of activation right along the muscles along the middle part of her back. And again, make sure that you don't feel any tightness or tension that's building up on the tops of the shoulders. All right, let's go ahead and reset one more time. All right, and the last thing I just want to point out is another common mistake that when people do the stretch is that they will start to overextend from the lower back like so, and they're not really focusing on much of what's happening through the mid to upper back, right? So as you do this, if you start to feel your lower back is overextending, then just make sure that you kind of reset, try to keep this area straighter and flatter, and just focus most of your effort and your concentration on trying to sink through the middle part of your back like so. Right, and again, just double check to make sure that you try to keep your shoulders down and away from your ears to keep your upper trap muscles as relaxed as possible as well. Hold it there for 3, 2, 1. All right, so that's it for the cow stretch exercise. One of the best ways to start to help you increase your posture and also help you reset and reposition the potential tightness you may be having within those upper trap muscles. So the next stretch we want to show you today is a stretch to help you open up any tightness or stiffness that you may develop within the muscle in the front of your chest, known as the pec muscle. All right. So the pec muscle, as you can see here, is a muscle that also starts to get very tight and very short for people who are in this kind of slouch or slump posture throughout the course of the day. And what happens is when this muscle is really tight, it can actually start to pull your shoulder blades forward into this kind of rounded shoulder position, which will not only wreak havoc on your posture, but it is also one of the main driving forces behind why you might be experiencing so much pain and tightness of that upper trapezius muscle that sits on the top of the shoulder. All right, so Tweet, go ahead and reset. So the pec stretch is very simple. All you need to do is just kind of stand in the middle of a doorway, just kind of bring your hands up to kind of meet each end of the doorway. And with your elbows kind of at a 90-degree angle is the best place to start. And then just go ahead and take one step forward, right? And just kind of make sure that your shoulders are kind of staying down and locked back. And then from there, just start to lean forward and just kind of stick your ribs forward. All right, and you start to almost feel immediately a stretching sensation right across the entirety of your chest, kind of into the front of your shoulder as well. All right, and then once you start to feel a little bit of a stretch, then just take one deep breath in, exhale, and just kind of push into the stretch just a little deeper, like so. All right, now you want to repeat this for about 5 times, all right, and just giving your body a chance just to kind of adapt into the stretch. And then once you have kind of realize, and once you feel like you're ready to go on, take a nice deep breath in, exhale, and then just lean into a deeper stretch like so. And let's just repeat that 3 more times, right? Now, if as you do the stretch, if you start to feel a lot of pain or a lot of tightness right in the front of your shoulder like so, then just make sure that your shoulders are kind of sitting down and back. Just make sure that you are feeling a more of a broad-based stretch throughout the entire front of the chest instead of at an isolated point in the front of the shoulder. All right, let's take one more deep breath in, exhale, and let's lean in and hold it for 3, 2, 1. All right, so that's it for the pec stretch to help you open up the tightness within the front of the shoulder to get your posture in a much more better relaxed position as well. All right, so the second underlying mechanism that causes this kind of constant or chronic pain or tightness of this upper trapezius muscle comes from problematic breathing patterns. All right, so what I'm referring to is the fact that, there are essentially 2 systems in how we breathe throughout the course of the day. The primary system is through your diaphragm, in which we use our kind of this muscle that sits at the bottom of our ribs to be able to kind of pull our ribs and to be able to pull our lungs downwards. And that is what essentially allows air to be able to fill up our lungs, which allows us to be able to get a good oxygen, flow throughout our body, which is essentially what allows us to stay alive. But there's a second system that most people don't know about, which is going to involve what is known as these accessory muscles, in which these are the muscles of the neck and of the chest. And these are muscles that typically want to kick in when the diaphragm isn't being able to work well or work efficiently. But what most people don't realize is that when they're kind of in a slouch or slump posture, is that this being in this position makes it very hard for the diaphragm to be able to do its job, to be able to pull those ribs downward, to be able to get that air and to be able to get that oxygen, all right? And so what happens is when somebody is in this position, go and take a couple of breaths to your chest, is you will start to see that the person starts to use a lot more of their neck, a lot more of their trapezius muscles to be able to generate that oxygen in through their body. And if we consider the fact that we take about, over 20,000 breaths throughout the course of the day, that is essentially going to lead to, this upper trapezius muscle, contracting 20 times, 20,000 times more than it should be throughout the course of the day, which is what could be contributing to why it's so tight and why it's so tired throughout the course of the day. All right, so what we want to do is to share with you some ways to be able to self-assess to see if you are kind of using this kind of dysfunctional or improper breathing pattern, and then show you some simple ways to be able to correct those patterns. All right, so Twee, go ahead and sit up again. All right, so the fastest way to be able to do this is to quite simply just put one hand on your stomach and one hand on your chest. Right, and just take a couple of very kind of medium-sized breaths in, and just pay attention to what your body actually does. Right, now in an ideal situation, what you should see is that the hand on the stomach, as Twee is demonstrating, when you breathe in, the hand on your stomach should start to elevate up and outwards. Right, this is a sign that the diaphragm is working the way that it needs to, and that she's getting a good, very efficient way of being able to deliver oxygen through her body. Right, now what's going to happen is for people that have more of a chest breathing or use more of their accessory muscles, is the fact that we go ahead and demonstrate the chest breathing, is that it'll look something like this. Right, instead of her hand on her stomach elevating, you're going to see a lot more motion, a lot more movement on the hand on her chest. Right, this is the clearest indicator that the person is more of a chest breather, which again is going to lead to a lot of inefficiency, and is again going to start to lead towards a lot more this kind of activation and fatigue of those muscles on the top of your shoulders. All right, So if you start to recognize when you try to do some of these breathing tests that you are more of a chest breather instead of a stomach breather, then we want to be able to help you become first aware of that pattern and then show you some simple ways to be able to correct that pattern so that you're not kind of using this upper trap muscle for breathing, which is something that we absolutely want to correct. All right, so if you do find yourself to be more of a chest breather than more of a stomach or diaphragm breather, then let's show you one of our favorite ways to help you start to correct some of these patterns, all right? So you essentially just want to do the same thing just by lying on your back, because it's much easier to start to retrain some of these muscles by lying down, because it is a little bit harder to do while sitting or while standing, all right? So Tweet, go and put one hand on your chest and one hand on your stomach. So again, you just want to kind of do the same thing where you just want to take a couple of just kind of medium-sized breaths just to kind of see what your hands are doing, right? And the end goal is for you to be able to, on your inhale, to try to get the hand on your stomach, try to elevate as far up towards the ceiling, like so, while making sure that the hand on your chest stays as soft and as relaxed as possible, right? And as you breathe out, just try to push all of the air out. And again, we want to kind of maximize how much that hand is actually moving, because we want to really to teach you how to train that diaphragm muscle to start to work better, because in a lot of cases, it just may not be doing its job. All right, so again, let's take a couple of deep breaths. Take a deep breath in now. You can see the hand on your stomach elevating all the way to the top. Hold it there for a second or two and breathe out through your mouth and try to push all of the air out. All right, same thing again, and make sure that you breathe in through your nose. Get the hand on your stomach to try to elevate as far up towards the ceiling. Let's breathe in. Very nice. Hold it for a second or two and breathe out through your mouth and push all of the air out as much as you can. All right, so this is a very good kind of diaphragmatic breath, and this is what we want to try to help you achieve. Right now, you might see when you try this that there might be, some tendency for the hand on your chest to start to move, and it might be a little difficult for the hand on your stomach to move, but that's okay. It's just going to take a little bit of practice, and try not to get too frustrated. Again, just try to focus your efforts and your energy on trying to get that hand on your stomach to try to elevate as much as you can towards the ceiling, and trying to get the hand on your chest to relax as much as possible. Right? It just takes a little bit of practice. It just takes a couple of repetitions, but I guarantee most people are able to kind of figure out this pattern within the first session or two. And again, it can start to make the world of difference once you can start to identify this problematic breathing pattern and then start to correct it over time. All right, cool. So that's it for the breathing correction. All right, now let's get into the next video. All right, so once we have done some of those corrective breathing exercises lying down, then we want to transition back in towards sitting, because it's typically harder to perform this pattern while sitting. And since a lot of people might be actually spending more time obviously upright than lying down, we want to make sure that some of those patterns actually carry over from the lying down position into more of a seated or standing position, right? So tweak one hand on your chest and one hand on your stomach. So again, just repeat the same thing again. All right, just take a couple of medium-sized breaths just to kind of see what your hands are actually doing. And again, we want to make sure that the hand on your stomach is pushing outwards when you breathe in, and then make sure as you breathe out, take a nice breathe out through your mouth as well. All right, so once you have kind of seen what your hands actually do, then focus your concentration and your efforts on trying to get the hand on your stomach to try to push outwards towards the other end of the room, and try to keep the hand on your chest as soft and as relaxed as possible. All right. All right. So deep breath in through your nose, push that hand out. Good. Hold it there for 2 seconds, and then push all of the air out through your mouth. Push it all out. Push all the air out. 3, 2, 1. Good. Let's do one more time. Breathe in and push out. And again, this is going to take a lot of time and a lot of practice, especially if you feel a lot of movement in through your chest. Again, just being able to identify that this is what your body is actually doing is the the first obstacle that needs to be addressed. And again, just practice it for a couple minutes a day. And once you start to be able to sync up that pattern, once you start to be able to identify how to actually engage and how to use your diaphragm, is going to make the world of difference when that muscle of that upper trapezius just isn't being called into action every time you try to take a breath in. All right. Let's demonstrate one more time. Deep breath in through your nose, hold for 2, and push all the air out like so. All All right, perfect. So that is it for some of the corrective breathing pattern exercises. Now let's get into the last thing we want to show you for today. All right, so the third underlying root cause of what I believe is potentially causing this kind of constant or chronic pain or tightness of this upper trapezius muscle comes from improper lifting technique. All right, so we go and demonstrate. Now, what a lot of people don't recognize is that when they lift anything above their head, when they're kind of in this slump forward or slouch posture, is that what they don't realize is that they might be potentially over relying upon their upper trapezius muscle to essentially lift their shoulder and their arm above their head, right? Now, this is going to potentially lead to a lot of, obviously a lot of, tightness and overuse of this muscle. But what it could also potentially lead to is a lot of pressure or a lot of kind of improper mechanics of the shoulder itself, which is what can potentially lead to something known as shoulder impingement, which could also lead to potential, rotator cuff problems as well. So if you find yourself every time you try to lift something above your head, you just feel a lot of pain or a lot of tightness either at your shoulder or just feel a lot of tightness of this muscle, then I'm going to show you some ways to be able to correct it. Right? So let's go ahead and demonstrate. So the first thing I want you to do is make sure that you are kind of sitting up straight with your shoulders back and your upper back as straight as possible. Right? And then as you lift a weight above your head, you want to try to keep your shoulder down away from your ear like so. And you accomplish this by trying to pull your shoulder blade kind of down away from your ear as well. All right, so we're going to pull the weight back down. Let's demonstrate very slowly one more time. So as the weight is coming up, what she's doing is to try to, again, kind of pull her shoulder and her shoulder blade by focusing on trying to squeeze and feel the muscles in the back and the bottom of her shoulder like here. And what this is essentially going to do is it's going to stabilize her shoulder blade and allow her upper trap muscle to essentially stay relaxed. Right? This is going to be a way safer way to lift, and it's also going to help you untrain some of those patterns that you don't even realize is happening of this upper trap muscle being way more active and way kind of more engaged than we want it to be. Right? So we're going to pull the weight back down. All right, so let's demonstrate it improperly again. So going around forward. Again, so as you can see now, the difference is when people are doing improperly, first her posture isn't set, and secondly, you start to see the distance from her shoulder to her ear is obviously way closer, and this muscle is way more tighter and way more tense, right? And that is obviously something we want to avoid. All right, so again, let's demonstrate it one more time. So again, sit up nice and straight, upper back nice and straight, and do this press very slowly, and pack and pull your shoulder blade down away from your ear, and try to keep proper distance of your shoulder away from your ear. And we should recognize, again, is this upper trap muscle should stay almost relaxed, and you should feel instead a lot more recruitment and a lot more engagement of the muscles of the kind of base of your shoulder and your shoulder blade like so. All right, 3, 2, 1, and go and pull the weight back down. Right? All right, so that is it for our demonstrations and exercise to help you be able to, permanently relieve that kind of constant or chronic, nagging tightness of those muscles of your upper traps on the tops of your shoulders. These are things that are usually going to take a lot of time and a lot of practice because of the fact that these patterns usually take years to develop in the first place. But I guarantee if you take yourself through all these stretches, if you just kind of work on them diligently and you really focus on trying to become more aware of what is actually happening with your posture and also the mechanics of your breathing and your shoulder mechanics as well, then I guarantee that this is probably the most effective path to be able to help you permanently get rid of that kind of constant and chronic nagging tightness on the muscles on the top of your shoulder. All right, so that's it for today. We hope that this helps, and we hope to see you all again next time. Take care and have a wonderful day.